Nicola, a little bit confusing here. Is the CDC saying that coronavirus cannot be transmitted through the air, or it's not as dangerous through the air as that initial piece that was posted on the website was saying?
Yeah, it seems a bit confusing, Adnan, doesn't it? But actually what they're saying is that the aerosol transmission is something that at the moment there's a lot of question marks about it. And they're saying that the extra addition that they added on Friday about the possibility of aerosol transmission was draft, and that's why it hadn't been through a proper review process, and that's why they've taken it down. Now, just to clarify the difference between this, we have the airborne transmission, which is when you cough, you sneeze, and we know that the virus can travel that way, but the heavy droplets drop to the ground within sort of something like 2 meters, and that's why we've had this social distancing gap between 1 and 2 meters. What has been a lot of speculation is about much smaller micro droplets. This is what this aerosol transmission is, that when you sing or you shout or you breathe deeply, that these can travel much further and can then hang around in the air. Now, this is something that the WHO initially was quite resistant to accepting, but then back in July it did vaguely change its wording on its website, saying that it was a possibility and that poorly ventilated and closely crowded environments were not ideal, and that was of course why they changed the recommendation that we should wear these face coverings to try and prevent some of these aerosol microdroplets from travelling so far. The CDC seemed to follow this on Friday by putting very similar wording on its website, but as you've just said they then took this down when the media picked them up on it, and they've taken it down, and the statement now is saying it was draft and it's going to be considered, and then whether they put it back on again or not, we don't know.
OK, some people are going to think because it's the CDC and because of how it's been disagreeing with Donald Trump that there might be some politics to it. But let's not concentrate on that for the moment. What about the scientific community? So about a month ago, I spoke to a leading virologist. I said, what about the transmission of this thing? Is it through touch and then touching our face, or is it through aerosol? And he said, no, it's still through touch. 2 weeks ago, I spoke to an assistant professor of medicine at the University of Chicago, asked exactly the same question. She said there's almost no evidence of people getting COVID-19 through touch and that it's all through the air. Is science still that divided about this?
You think so, isn't it? It's interesting you've had that experience, because I've had something pretty similar. I was speaking to Professor Paul Hunter, who's Professor of Medicine at University of East Anglia. I think you've spoken to him live on the programme in the past, actually, Adnan. He said to me that the evidence about this aerosol transmission, these tiny droplets, is quite weak. He said if it was the case, if the droplets were hanging around in the air, if someone was in a restaurant, who was infected, they left the restaurant, you or I went in afterwards, we would then be infected with the virus, and that isn't happening on a wide scale. However, nearly 240 scientists, top scientists and medical experts, signed an open letter that was printed in the British Medical Journal saying, hang on, we need to investigate this a lot more, because there was evidence that respiratory infections such as SARS and MERS, the Middle Eastern Respiratory Syndrome, and flu did pass on the virus that way, and they feel that more needs to be done to investigate this. And they quote that there was a choir in America, in Maryland, America, where 87% of the members came down with COVID-19, 2 people died. And there was one restaurant in China where 3 people became infected, and there's no evidence that they had been in contact with somebody who'd been infected. There was speculation that there was perhaps the virus on a pepper pot that was used by somebody and then used again, which is of course why cleanliness is so vitally important. But I think you're right, it depends on which scientist you speak to as to what the situation is at the moment. And remember, we've only known about this virus since the beginning of this year. All the scientists, all the medics, they're learning about it. And as they learn more, are they going to contradict each other? I don't know, but we're certainly going to be bombarded with more information.
Absolutely, and glad to have you sifting through it all, Nicola. Thank you so much. Our health correspondent, Nicola Hill.